Everybody hear me? Yeah, good. Okay. So I wanted to bring us back to a bit of a health theme, because I think we've had a few sort of varied themes this morning. I think one of the titles of the event is going from F1 to advanced healthcare. So I didn't really want to spend very much time talking about Formula One, if that's okay. I really wanted to talk a little bit more about healthcare. So I think when we think about health and wellness, we think about a whole spectrum of things. So we think about care for people in hospitals, we think about care out in the community, we think about consumer healthcare, we think about medicine development in pharmaceuticals, we think about athletes using this kind of technology in their training and preventing injuries and so on. So it's a very broad spectrum. But we're really serious about health, and we think there's some real contributions that we can make, but we do those very much in a co-creation and a collaborating way. So we're not coming in saying, we're going to parachute ourselves into the health service, we know exactly what you guys need to do, off we go. It's very much about us tendering some things that we know about and some principles that we have and some technologies that we have, and trying to work with people to make sure that actually that technology does properly get adopted. It's not about data, it's about insight, and it's about getting that adopted. And I think that's the really crucial thing. So just as an example of the kind of things we're doing in health, actually we've just announced a partnership yesterday with Oxford University, looking at healthcare for the next 3 years, and kind of examples of things that we'll be doing there is looking at the role of simulation in helping surgeons and training surgeons, how we can improve the patient journey through various facilities and so on in healthcare, and many other things that we're going to be doing. So that's just an underlining really of our seriousness about this space. So very, very quickly, why is Formula One even relevant? Well, actually, it's all about data and the derivation of insight from data. And really, the only Formula One picture that I'm going to show is this one. And this is a picture from quite some time ago. And if any of you followed Formula One many, many years ago, you'll be familiar with the fact that the dialogue between a driver and their mechanic used to be a pretty verbal dialogue. There wasn't really a great deal of data to go on. So this was, how's the car going? Oh, it doesn't go so well around the left-hand bends. What do we need to do about it? Do we need to stiffen it up a bit? Yeah, maybe it feels like that might be the thing to do. Very subjective conversation. To today, we have 500 sensors on each car, kicking out data at about 1,000 hertz. There's loads and loads of data to go at. We can make a much more objective judgment about how to improve the car. And so, in a way, the hypothesis is where we are with monitoring humans today, a bit like we were with Formula One cars about, in the 1960s. I don't think we're quite as bad as that, but I think there are some similarities. If you think about the dialogue that you might have with your GP when you're going for a medical appointment, actually there's very often some very subjective data to go on and not a lot of objectivity. So just to illustrate the point of data, insight and adoption as three pillars, we actually got involved in this back in 2007, and a pharmaceutical company said to us, if you could produce a device that would enable us to monitor ECG at 1,000 hertz and transmit it from the patient to a doctor that was somewhere else, you'd solve a huge problem for us. So being the engineers that we were, we said, right, let's go do that. We didn't ask them whether they really needed it or not. We just thought, yep, let's go do that. So we went off and achieved it. We demonstrated it. We sat some doctors in a room. We had a patient on the other side of the Atlantic, and we said, here's your 1,000 hertz ECG. And they gulped, and they said, what on earth are we going to do with it? And secondly, it's going to be a liability if we got it and we don't do anything with it. No thanks. So that was a real indication as to the kind of things that you need to think about to get this kind of technology adopted. And so I think we've learned quite a lot since then. So summarising what I've just said, data is everything, but actually nothing without insight and adoption. You need to get something out of the data, you need to derive something. Can you make a decision from it? Can you make a diagnosis? Can you make something better? Can you spot something earlier than you would do if you were just looking at them as a doctor-patient relationship? But actually, if you can do all of that, you've still got to get it adopted and get it embedded in the patient pathways and so on. So I just wanted to now almost just illustrate some of the things that we've been doing along this journey to our vision, really, that technology that is very relevant in Formula One in terms of getting data from pieces of equipment or from people and deriving some insight from that is of value and can make a real difference. We've got a real vision that can be applied in all sorts of areas across healthcare. And I talked about the fact there's a real spectrum there, and I'm just going to go through some points on that spectrum. So we started out, after having our experience with that pharmaceutical company all those years ago, we started out actually with Olympic and professional sport. And Olympic and professional sports people are actually pretty, they'll put up with a bit of burden in terms of getting things strapped to their bodies and all that kind of thing to get an advantage. So we worked with the British cycling team. This is actually, you can just see the little McLaren word at the bottom here. We worked with the British cycling team to put a device on their bikes so they could get data as they were going down the velodrome. They could get data straight away. They could derive the metrics from that they wanted to understand how to make some changes to that training session to make it more valuable for the athlete, and then they would immediately make that change. And that was from a situation where they used to collect the data, they had it coming out their ears, but it took them 2 weeks to process the data and come back and decide what to do. We were doing it instantly by the side of the track. We started doing that in professional sport with the English national rugby team. So this was about injury prevention, actually. If you know that a rugby player has been through a certain amount of tackles and a certain amount of force of tackle through a game, there's a well-known rule of thumb that once they've been through about 5 Gs worth of tackles, you really want to substitute them and take them off because they're going to get injured. So we worked with them to, again, they were already collecting data, but they didn't really know what to do with it and what insight to get, and we helped them do that. And rugby is quite unusual because you can actually do that in-game as opposed to just in training. So good grounding. Is there a massive business opportunity in that area? Not sure. I think there's more opportunity in mainstream health and wellness, but that was certainly a really interesting place where we continue to break new ground and to test new technologies. So we went back to the pharmaceutical world 3 or 4 years ago, and we started a relationship with GlaxoSmithKline. And we started to work with their people in R&D to understand, well, where could these kind of capabilities, things like modelling and simulation, deriving insight from data, where could that be used within the context of medicine development? How could it help GSK produce better medicines for patients more quickly and more cheaply? And one of the things we discovered is that actually clinical studies where they test these medicines are incredibly poorly served by data at the moment. So somebody will come in maybe once a month during a 3 to 6 month study. They'll have a study visit. They'll be asked a lot of subjective questions that are recorded on a questionnaire about how they're feeling. There might be, in case of something like a stroke patient, for example, they might be asked to walk 10 metres and to time how long it takes them to walk those 10 metres. But of course, there's all sorts of factors that can affect that in terms of how nervous they are, in terms of what's happened just the day before, and so on. So we worked with GSK and realised that if we were able to monitor for a few days after each of those study visits how much movement a patient was making, that was a good parallel with what recovery they were making from stroke. So we've had a clinical study where they've been testing a medicine for stroke, and we've had data coming back from patients that we're deriving insight from that's helping them understand more about how that medicine is working and how effective it is. And that's just the first of many that we'll do in that area. In neurodegenerative diseases, so stroke's obviously in that family, but in the press at the moment there's a lot of talk about ALS. So you've heard of the ice bucket challenge, so people getting doused in buckets of ice cold water, and that's about research into a particular family of diseases, and ALS is one of those. It's, I think, motor neuron disease is another word that's used for some of those diseases within that family. And what's clear there is that actually people don't really understand, clinicians don't really understand how that disease progresses in terms of, how can you diagnose it and understand how far progressed that disease is. There's all sorts of factors. We got a number of experts together in a room and started to understand the symptoms that they start to look for. It's incredibly complicated. It could be anything from slurred speech to movement disorders to tremors to there's all sorts of different things, and so that's really ripe as an area where you can begin to put some sensors on patients and really understand data from an objective perspective as opposed to making a subjective judgment. So again, good example of where this can be used. So then once a medicine's out there, we've all heard in the press about the fact that actually patient adherence is really poor. So are people taking the medicine? So GSK have spent billions of dollars producing this great medicine. 50% of people don't take it. I don't know exactly so don't quote me on that, I don't know exactly what the figures are, but I think there's a high percentage of people don't take medicines in general. And so one of the things we can do is, if there are devices involved in people taking those medicines, we can begin to show that person, well look, you took your medicine these 3 days, but you didn't take it these 2 days, why not? And then when they go and have the dialogue with their doctor can see whether they've actually taken that or not. And this adherence thing is incredibly complicated. I mean, many patients really hide from their doctor the fact they're not taking their medicine. And that makes life for the doctor very, very difficult. So I think there's great potential here for digital medicine to effectively put sensors on these devices to understand whether somebody's used them or not. And again, we've been working in that area. Big social issues. So weight management. Massive issue. So how can we do more about that? Well, I think studies have shown that if you put a pedometer onto somebody who's a bit overweight and you're trying to prescribe exercise and give them nutritional advice, it doesn't necessarily really help. But what we did was we put some sensors onto some patients who were undergoing a weight management program with a local doctor's surgery. They were being prescribed exercise, prescribed nutritional advice, and we just gave them at all times an indication of how many calories they'd burnt that day. And out of the, I mean, it was statistically insignificant, so there was a very small group, but out of the group of 8 that they had, they'd been doing this for years and years and years, and they had the highest average weight loss they'd ever had and the highest individual weight loss. Now, and we're just in the process now of repeating that with a bigger study to see whether there is some statistical significance in that. But certainly anecdotally what we found was that patients said, wow, you know, I ran for the bus today, I ran around the supermarket, I went to pick up my child from school, I thought I'd had a really active day, deserved a really big meal tonight, and I've learned that I've burnt 27 calories, and you know, clearly that isn't helping. I really need to do some proper exercise. So that was a real learning of how you can close the loop there of, you know, it's about the technology, it's about the patient experience, it's about educating the patients. All those things come together to get the results that you want. Moving more into patients in hospital, we've got a project we're running actually funded by the Wellcome Trust at Birmingham Children's Hospital. And actually Isansis over there, they're one of our partners on that project. They're collecting data from sick children, and at the moment clinicians are, and we're helping to then process that data. And clinicians at the moment are looking at that data from the patients, and they're trying to understand if there's a likelihood of a bad event that's coming along, maybe for a cardiac patient, somebody like that. And they're pretty good at it. But actually we showed in a pilot in the last couple of years that actually if you apply some machine learning to that and you understand what normal is for those children, and then you start to compare the signals that you're getting with what is normal for that child, actually you can begin to spot some things quicker than a clinician will spot it. So again, we're not replacing clinicians, it's just sitting alongside them, it's just helping them give them more information to make the right decisions. But again, just early indications that there's some really interesting things there that can be achieved. Moving more into the sort of outside world, if you like, of people who aren't necessarily ill but are trying to get the most out of themselves. We think there's a lot of potential here. So I think whether you look at we did work with industries where, safety critical industries, where understanding fatigue in the workforce is really, really important. So can you measure fatigue more objectively than making a subjective judgment about somebody when they come in the morning? You know, can you prevent people falling asleep at these really important jobs? Can you have an executive who, when they know that they've got a board meeting tomorrow afternoon, what should they be doing today in terms of diet and rest and exercise to make sure that for that meeting at 2 o'clock tomorrow afternoon, they're in the best possible state? You can use predictive analytics based on data to help you do that. Consumer healthcare, consumer devices like mobile phone manufacturers and so on. There's a huge revolution in the quantified self movement. There's all these fitness devices, but we actually think you can go way further than fitness. You can begin to look at cognitive health in terms of how ready you are for particular activities, how much mental energy have you actually got. These are all things that I think in the next couple of years we'll be able to do quite a lot with, and people will be able to get more out of those to be in a better state to do their jobs, but more importantly actually to be in a better state when they get home to spend time with their families and so on, if they've been able to measure their energy better across the day. So I think all that adds up to the fact that there is, there's a lot that we've done here already, a lot of overlap between engineering and healthcare, and we think there's a lot of benefits that we brought there. But equally, there's lots more that we can do in the future. And I think at the moment there's a general theme that a lot of these devices are, yes, people are sort of educating themselves about themselves and so on, but the algorithms that run on the devices and so on are very across the population. They're designed to work with everybody. Whereas I think for this particular world, I think actually there's a lot of mileage here in beginning to look at data for individuals and understanding the individual, understanding the context in which they're living their lives, and then beginning to make interventions and recommendations for those individuals as opposed to comparing them with the population. And I think that's going to be a big theme moving forward. So thank you very much for your time. Hopefully that's given you a taster of the kind of things we're up to.